So our first finalist, Jeffery Nielsen from Purdue University and Novastio Incorporated, and he'll be presenting his talk on improved bone fracture repair through targeted delivery of angiogenic agents. All right, Jeff, go.
Bone fractures represent a huge health issue, as we all know. Patients over the age of 65 have a 1 in 3 chance of dying within a year due to their fracture, and this represents a large public health problem, which most improvements have largely revolved around stabilization of the fracture and not the generation of new medicines. And so there's a great need to develop new drugs to treat bone fractures. The majority of drugs fail in the clinic, about 76% of them due to safety concerns. Safety issues largely revolve around localization of the drug in the wrong parts of the body. If we can get a drug just to where we need it, you can dramatically improve the efficacy and reduce the safety concerns. The blood is well understood to be a very important part of healing a fracture. As we go from just the hematoma phase and the inflammatory phase to the soft callus formation and fracture healing, one of the largest changes is the revascularization of the callus. If we could increase that revascularization, it is possible that you could accelerate the time it takes to heal a fracture and allow patients to get on their feet and move faster, thus reducing a lot of the negative side effects due to immobilization that occur with patients with fractures. The blood serves a very important role in providing cells and nutrients to heal a fracture. What we have found, if we can utilize what the body does to localize proteins to the bone by using change of acidic oligopeptides, chains of acidic amino acids, we can localize drugs very specifically to a fracture. As you can see on the skeleton on the right, the SPECT CT, relative to what a free drug would do. We found when we used this system and attached different known angiogenic agents that we were able to produce a very controlled localization of the drugs there, but also several known angiogenic agents were able to not only localize well to the fracture, but they were able to dramatically improve the healing of fractures. We went through and screened a number of known angiogenic agents, as you can see on the graph on the right, and one of those, QK, is a known mimetic that signals through VEGF. We found that VEGF was able to produce a robust improvement in density and also strength of the resulting fractures. We found this result not only occurred in healthy mice, but we tested this in mice with type 1 diabetes as well, and found that we were able to dramatically improve the healing in a disease type that might be common in the elderly. We think this has a potential to create new and improved therapeutics and to control where the drug is acting. Thank you.
Okay, does anyone have a question?
So I could ask a question, Sarah. Thanks very much, Jeff, for a very kind of clear presentation. I wonder, what are the other areas that we see in patients that have a lot of problem with the vascularity, are the high energy injuries? And I wondered if you'd thought about mimicking that at all, and whether or not, if there was a high energy fracture, whether your model would be able to look for improving the vascularity with that.
Yeah, there are an awful lot of diseases that involve vascular damage. And the localization technique we use here with acidic oligopeptides is more specific to mineralization and exposed hydroxyapatite. So we focused, and we've done this with more than just fractures, but we're focused primarily on diseases that involved exposure of raw hydroxyapatite. One particularly interesting might be in the case of, spinal fusions. You are trying to essentially force the body to create a bone bridge and getting vasculature to grow in there. We've found that these therapeutics, these angiogenic agents, work well at forcing these scaffolds to become vascularized and thus, mineralized. And so it's been useful outside of just fractures that are, this is an Einhorn fracture model, but there are absolutely implications beyond just fractures in terms of using angiogenic agents. The problem generally is controlling where they go. You don't want blood vessels to be forming everywhere in the body. And so this technique is revolving around using mineralization targeting, but there could be potential if we can find other targeting techniques for other diseases where increasing blood flow would be very useful.
Thanks very much, Jeff. Thanks.
Thank you, Jeff.